Hi, everybody. This is Dr. Melissa Clarke again with another episode of Excuse Me, Doctor. I am so happy to see everybody joining for another week. And of course, we're here every Monday night. Welcome to my Facebook family, as always. Welcome to everybody watching on YouTube. Please remember to hit that subscribe button, that red subscribe button, to subscribe to the channel and get updates anytime we post a new video or anytime we go live. So I hope everybody had a great weekend. Looking forward to this show. There is so much to talk about this week in health related news, and we are definitely going to be covering it all. In addition, we have some wonderful, wonderful guests with a topic that I know everybody is really focused on because I've gotten so many questions about dining out and restaurants and food and what's safe and what's not as different places reopen, and we have, different things going on in different parts of the country. So this is going to be a really action packed, I guess is the word, chock full of information show. And I'm so glad that everybody is joining us tonight. And, like I always say, pull up your comfy chair, get your popcorn, get your favorite beverage, get your healthy snack, and sit down, get your questions ready, because our guests tonight are ones who are going to be wonderful to engage in dialogue, and I'm sure are going to have the answers to all those pressing questions that are on your mind. So, as we are seeing more people arrive, I am just going to go ahead and get started with our weekly update. And as always, I start with the numbers. So we are above 3.3 million cases in the United States. Thankfully, 955,000 people have recovered. And unfortunately, of course, we've had over 136,000 deaths. It's staggering every time I say the number. And I start working on my updates starting on Friday, and I watch the numbers change over the weekend, and it's disheartening. It really is overwhelming, especially in light of the fact that there's no plan, no clear national plan to address what's going on. And with these numbers, we're seeing cases surge in over 37 states. We see that in Florida especially, the situation is dire. And I saw one article that broke it down in terms of stats from Johns Hopkins. They keep that tracker, right? So if every state in the United States was considered like a country, right? So that you could compare the case rates in states to countries around the world, do you know that we would be number 1, 2, and 3 in terms of Florida being number 1, Arizona being number 2, and South Carolina being number 3 in terms of the number of cases. The next country behind that is Bahrain, which is number 4, and then we are back at the number 5 position with Los Angeles, with California. So, we are basically leading the world. Obviously, the United States is, but even on a state level, we're still leading the world with positions 1, 2, 3, and 5 in terms of the total number of cases. Other countries that are up in that ranking include Russia, China, and Brazil. We're beating all of them. And in the midst of this, states have been reopening. Now they're having to dial back. There are at least 8 states that are dialing back or should be dialing back based on the number of cases that are surging. Florida, California are closing bars and indoor dining. And, we're going to hit on that tonight with our guests for sure. Our next topic after the numbers are the fact that people are actually asking doctors for waivers so that they don't have to wear their masks inside stores. And this is kind of taking the form of, oh, I have asthma or I have a lung condition and, I can't breathe in my mask. So, I read up on this. The chief medical officer of the American Lung Association, so he is a lung specialist and he's a leader among lung specialists, basically made 3 points. The first point is that if you're that high risk in terms of your disease process, you probably should be staying away from situations where you could catch COVID-19 if you think that you can't wear a mask. You basically should be isolating yourself away from everyone else. Secondly, a lot of times people who have lung disease and people who've had COVID also say this, that they get anxious, even if their numbers are okay on their oximeters, on the device that measures your oxygen reading in your bloodstream. Even if their numbers are okay, there tends to be an anxiety that goes along with having a chronic lung disease like asthma or COPD. And so lung doctors often have to acclimate those patients to, for example, if they have sleep apnea, to wear a mask. And so they tell them, well, sit in front of the TV with your sleep apnea mask on for like 30 minutes and just use it. And so they're distracted by the TV so they can kind of get used to it. So doctors are now recommending that if you feel anxious with a mask on, just sit with the mask on, kind of get used to it over a 30 to 45 minute period, the same amount of time that it might take to walk into a store that you would need to wear a mask, and just see how you feel. And then lastly, you should never be wearing tight-fitting masks. The kind of mask that is recommended for the public to wear, like surgical masks or cotton cloth masks, should be breathable and are breathable if they're cotton. And if they're surgical masks as well, they have openings on the side so carbon dioxide doesn't get trapped in there, as is a common myth, and oxygen flows freely. So there really should not be an issue with wearing masks in public. The next thing I want to talk about is some treatment news. So the first thing is that there's a drug called remdesivir. You probably heard me talk about it. Preliminarily, we already knew that it cut the duration of time that people in the hospital have symptoms so they can go home sooner. Now we're actually seeing that it may have a role in decreasing deaths by up to 62%. So we're waiting until August for the absolute best study to come out about remdesivir to see if it backs up these preliminary results, but that's something to keep an eye on. And the other thing to keep an eye on is the fact that CBD, which is a component of cannabis, is being tested in certain trials for its anti-inflammatory properties. As you know, in COVID-19, inflammation in the body is a problem, so we look for medications that can treat that inflammation, and CBD has emerged as a candidate. Now that's CBD without the THC, which is the part that makes you high. And we're not talking about smoking it, right? Because smoking it can irritate the lungs and defeat the purpose. So we're talking about medicinal grade CBD that would be administered orally or through the skin in clinical trials. And so we have to wait and see what that shows. But wanted to share that with you too. The next thing I wanted to talk about is the fact, unfortunately, that the death rates for COVID-19 are going back up. Now, when I started preparing for the show, they were going down, and that was last week. But just as of yesterday and today, we're seeing that in the states where the cases were spiking, the death rates are now, unfortunately, going back up. Death rates were initially going down because doctors have more knowledge about how to treat. We have things like the 5-day course of remdesivir, steroids, dexamethasone administered in the hospital. Again, the importance of doing that in the hospital and not at home. And also blood thinners. So all these treatments, as well as turning people on their stomach so that they can breathe better and hopefully avoid having to get on a ventilator, all these things are great news in terms of treatments and had been helping the death rates go down in many places, but it has to be coupled with people making those behavior changes, avoiding crowds, wearing your mask, washing your hands, and being consistent in those behaviors as well as being able to have access to testing, which we know is still inadequate in many places. And then the other thing I wanted to talk about is, a lot of the politicians are saying, oh, well, we don't really have to worry because it's young people who are getting affected. Well, it's young people who are getting affected for now. And that's primarily because of people attempting to go to summer camps, like the Christian camp that opened up, and 82 people, including camp counselors and young people, got infected. Young people have also been going out to bars and restaurants at a higher rate than older people who have been a little bit more cautious for the most part. I mean, there's a gross generalization, but that's why younger people, I think, who venture out more, who interact with each other more, are getting the virus more now. But the concern is that they're going to bring it back home to people who are more vulnerable than they are, and they may have no symptoms. And we know that in the first, the 48 hours prior to your getting symptoms is the time when you're most infectious. So all that's important to keep in mind. Even though it's, younger people are getting it now, doesn't mean that they're not going to pass it on to older people down the line. And then finally, with the update, the president withdrew from the WHO. Does that really mean anything, though? Well, if carried forward, yes, it can mean major issues in terms of international cooperation to find a cure, develop vaccines, and then even if the United States is not part of the WHO, any advancements that are made, the United States won't be able to share in those advancements in terms of access to vaccines. But the good news is that according to the 1948 treaty with the WHO, we can't just pull out and have it be effective tomorrow. It can't take place until this time next year. So if we get a new president in the interim, they can easily reverse that, and all will be as it should be with us participating as part of the WHO. So that's the weekly recap. Let's move now to our weekly debunk. And our weekly debunk this week, I heard that the reason we have more cases is that we're testing more. And you know who we heard that from? Well, let's talk about that. So yeah, we are testing more. We finally have ramped up. We are 5th in the world in terms of the amount of testing we're doing per our population, right? So you've heard, oh yeah, we're number 1. We're doing the most tests out of anybody in the world. No, that's not true. We're 5th in the amount of testing we're doing per population. The United Arab Emirates, the UK, Russia, they're all ahead of us, right? So if indeed, we were getting more cases because we were testing, you would expect that the amount of people testing positive would stay constant or maybe even go down. But we're actually seeing the number of cases of people testing positive, the percent who are testing positive, is going up, up, up. In Florida, I think it's something like 1 in 4 people are testing positive for coronavirus who get tests. So that totally debunks that theory that our cases are rising because we're testing more. No, our cases are rising more because there are more cases, because more people are going out, more people are spreading the disease and the infection in their communities, and that's one of the reasons why we're getting more cases. So that is our weekly debunk. And now I am excited to move forward with our topic for this week. And that is restaurants and restaurants reopening. And, this episode, I said I'm dedicating it to my foodies, to people who like to eat out and who just want to know, is it safe? What are the challenges that restaurants are going through, and what have they had to do to make it safe for you to feel comfortable dining in the restaurant, dining outside of the restaurant, picking up food? Different areas of the country are in different phases of reopening. Some have surged forward and some have had to dial it back, like I mentioned with Florida and California. So tonight we are really honored to have two restaurateurs from Washington, D.C. Washington, D.C. is currently in phase 2 of reopening, which means that restaurants can reopen for limited indoor dining, limited capacity indoor dining. And in addition to our restaurateurs from DC, we have a superstar public health leader who's going to lend her expertise to the conversation. So, without further ado, I want to introduce our restaurateurs, Kamal and Sonya Ali, who are owners of the iconic Ben's Chili Bowl. And Kamal, I'm going to introduce him first. He grew up in DC working at his family's business, Ben's Chili Bowl. And it started on DC's historic U Street corridor, also known as Black Broadway. And he has been a co-owner through the successive phases of expansion, such that now there are restaurant locations in many areas of the city. So welcome, Kamal.
Hi, Melissa. Thank you.
Absolutely. And next to him is his wonderful wife, Sonya Ali, who is also a co-owner. She is a self-proclaimed foodie, and she oversees operations in several of the locations, as well as human resources and some of the day-to-day operations. In her life prior to Ben's, she has a history in aerospace medicine and is a retired U.S. Air Force reservist. So welcome, Sonya.
Thank you so much, Melissa, for having us.
Absolutely. So glad to see you. And then our next guest is Dr. Sandra Elizabeth Ford. She is the Commissioner of Health of Dekalb County, which is outside of Atlanta, Georgia. And as such, she is also, too, as if that's not enough, she is also the interim director of the Fulton County. She is the district health director on an interim basis there. She's a board certified pediatrician. She manages a diverse array of public health programs that serve over 730,000 people who live in the county. And under her leadership, they've gotten more than $15 million in federal funds to address healthcare disparities. She's also the incoming president of the National Association of County and City Health Officials. And I'll let her talk about that. And she's going to assume the presidency next year. So welcome, Dr. Ford. Thank you for being here.
Hey there. Thank you so much for having me.
Absolutely. So I'm actually going to start off with the Alis. So I know that you all basically have never shut down in this pandemic, or if you did, it's for a brief period of time. You've been helping to feed DC as well as frontline healthcare workers. So tell us a little bit about how the transition has been and how business has been since March.
Yeah, well, the original location, Dr. Clarke, at 1213 U Street Northwest is the one that we've never shut down. We have a history there of being there throughout the riots, throughout the drug wars, throughout the metro construction, and we kind of refused to shut that one down. That one kind of represents Washington being alive and well, and we go down there whether there's a couple of customers that need service. So that one we never shut down, but we did shut down the other locations. So all the other locations were shut down, and the one on U Street, we only opened one shift continually, and we're still only open one shift. So many of our workers are, afraid of the COVID. They're home collecting unemployment. And so we only have enough staff. We've worked double time, so to speak, as the owners to keep that store open.
Absolutely. And actually, I just saw someone pop up on the screen that you help to feed their healthcare team. Maybe you could tell us about that.
So one of the things that we've been doing throughout this COVID, I call it COVID catering, and we have come up with these individual box meals that contain everything. So there doesn't have to be any kind of cross-contamination or people touching the food as you would in a normal catering situation. And so we have been blessed on many fronts to have had a lot of donations come in and have requested these meals be sent to frontline workers at various hospitals, fire stations, et cetera. And we have probably done over 400 to 500 meals to Howard University Hospital alone.
Wow. Wow. And for those of you who don't live in DC, Howard University Hospital is right around the corner from their 12th and U Street location in DC. So, keeping everybody happy and well fed is very important to healthcare workers' mental health wellness. so,
Right.
Dr. Ford, you are right outside of Atlanta, and so maybe you could tell us a little bit about. Actually, let me back up for the audience. A lot of people might not realize that restaurants fall under public health. And you can probably imagine why. So, Dr. Ford, can you tell me in the Atlanta area and in Dekalb County, what stage of reopening are you in, and where are your restaurants falling within those guidelines?
Well, so first of all, as a former Howard University Hospital employee, I would like to thank the Alis for taking care of my folks over there because my heart is still with HUH. Um, in Georgia, we are at stage 2, but we are very broad stage 2. We have pretty liberal openings at this point. We probably need to be back at stage 1 in some areas of the state, but that hasn't taken place in a formal way yet. In terms of restaurants, there's so much going on, staffing, distancing, just plain old sanitation. And this is one of many struggles that I deal with every day, is just trying to figure out what's safe, what's not safe, and how much of the regulations actually can be enforced. Because, we have things about social distancing, but, law enforcement, truth be told, doesn't have the time or the manpower to go and cite every single person that's not adhering to the guidelines. So it's a constant struggle. And I think restaurants are one of many methods of transmission in Georgia that we are struggling with right now.
So, given that that in Georgia, you mentioned phase 2 is very wide in its interpretation, what would you, as a public health official, advise people who are high risk about eating out?
So, my guidance has been, just because you can do something doesn't necessarily mean that you should. And these decisions have to be made on a very individual basis, because, just because they say, well, it's okay to be out and about. Like, for example, right now, the minimum gathering that's allowed, or maximum, excuse me, is 50 people in a restaurant and tables of 6. But if you have a fragile immune system, then that may not be such a great idea for you, and you might still want to be getting your food takeout. I think that one of the things we talk about, Georgia, particularly Atlanta, is a very urban setting, and as is Dekalb County. And so lots of multi-generational situations where grandparents are living with very young folks. And so it's not so much the young folks who, while their numbers are increasing in terms of infectivity, they tend, and I say tend, to recover more completely. However, that does not negate them from spreading that infection to folks whose immune systems might not be as strong. And so a lot of these happy hours I see online, they literally just make my heart flip, because, when you see 60, 70 people all gathered up, congregated like that, we know 2 weeks from now we're going to see surges in cases.
Absolutely. Absolutely. So, Kamal and Sonya, you mentioned that you have some staff at your restaurant who are concerned about getting COVID. How are you dealing with protective equipment for the staff? How are you dealing with issues? Is there a way to sort of relocate some people into other areas of the business? How are you dealing with that whole staff issue and their protection?
Well, it's been totally voluntary. So those staff members who felt uncomfortable and don't, or feel uncomfortable and don't want to come to work, we have not asked them to work. They've taken off. They tell us they have small children. They live with their mother. These types of things, and they're scared. And so we understand that, and they stay off of work, and they're thanks to the unemployment programs, some of them are making good money by staying at home and staying safe, which is great. Others have chosen to work or want to work. Everyone's in a different situation. Everyone has a different comfort level. So those have been far and few between. And so those who do come to work, we allow them, and we do everything we can in-house as far as gloves and masks and protocols to try to keep them safe. And as the environment changes, we try to stay current with our mayor's edict and laws and follow those guidelines. And it's a little bit random. It's a little bit scary for everybody, but we just do the best we can.
How have your customers been reacting?
Well, we've really expanded our delivery services, and so that's been a big help. And we've had great partners in Grubhub and Uber Eats and these type of delivery services. And so we have curbside service, online ordering, and we've developed that and worked on that. So that's much better. So you can just order your food online, whether you can come in and pick it up or call ahead and let us know. Call when you're outside and let us know. We'll run it out to the car. So curbside service, or if you want Uber or Grubhub or one of these guys to deliver to you, that's also available. So that's been a big part of it.
And Melissa, one of the things is while we are in phase 2 and we can have guests eat in, we have chosen not to start that just yet because we are trying to make sure that we have everything we need in place to keep our team as well as our guests safe.
But the city has been really good about this phase 2 in that they are allowing people to eat outdoors in areas where they previously wouldn't. Right. And so on either side of us, there's an alley on the Ben's Chili Bowl side, Ben Alleyway, and there's an alley on the next door side. And so both of those areas, we have tables and chairs, and we just bought some tents. And so people do have the option of eating, but I think that people are much more comfortable eating in an open air environment than they are indoors. So we allow that as well.
Okay, great. So those alleys they're not actually staffed by you. It's just people can bring their chairs and sit out there and eat the takeout that they ordered.
That's correct. Okay.
Well, we provide the tables and chairs and the tents. They're out there already, and we make sure that at least every 30 to 40 minutes, our team is going out there sanitizing the tables and chairs, but there are tables and chairs on both sides. Mm-hmm. And people can come in the store and place an order. We have minimum number of people who can come in at a time, and you can place your order if you choose not to order online or through one of our third-party delivery services.
Got it. So Dr. Ford, in one of the provisions of phase 2 in DC in terms of reopening is that restaurants have to keep a log for contact tracing purposes. Is there anything similar in Atlanta? And if so, how's that going?
No. And I say that like that because the health department is responsible for contact tracing in Atlanta, and we are overwhelmed. I don't think that, think about it. 2 months ago, no one knew what contact tracing was. And now all of a sudden, everyone is a proclaimed subject matter expert. And contact tracing is a challenge because there are certain populations of folks, and that includes us, who tend to be very suspicious of random people calling them and asking, who have you been around in the last 6 or 7 days? And so there's a lot of issues with disclosure, distrust. What are you going to do with this information? My county, Dekalb County, has the largest refugee resettlement community in the southeastern United States. And so folks are very concerned about their information being shared. We also have a large undocumented population who think that this is a sting, that folks are coming for them. And so no, the restaurants in and of themselves could not manage that process, particularly with the numbers that we're seeing in Metro Atlanta. So it's a health department responsibility with help from a lot of friends.
Right. I think that the spirit of this provision that I was reading it is not that the restaurants would be responsible, but just that they keep a log, especially I would imagine for those that have indoor dining, that they keep a log of who their indoor customers have been. So that if there is an outbreak, the health department can easily look at that log and then go back and figure out who was there. I think that's the idea behind it.
That would be delightful. But I suspect if we started that at this point, you would get a lot of Bugs Bunnies and Daffy Ducks that had signed in. I have no confidence that people would tell the truth. And you would have to provide so much additional information. So it would have to be your name and a contact number, or your name and an email. And, I think that's part of our challenge. We've been getting actually calls from a lot of the fast food establishments saying, we have a staff person that's been tested and is positive. What do we do now? And we're like, oh gosh, how do you track who this person served 3 days ago, 2 days ago? So it's a big challenge. That I'd love that. Maybe I'll try to suggest it at the next council meeting.
Yeah. Sonya, you look like you wanted to mention something.
Well, so one of the things that we're doing at our full service restaurant is that guests who want to dine in have to they have to go on to this app and fill out the information. And once they've completed it, they'll hit that it's complete, and they have to show that to the hostess or to the manager in order to be seated inside. And the other thing that we are doing so that we can begin to take guests in our Chili Bowl restaurants, the one on H Street and the one on U Street, is to do that same thing. There's an app that you would log into, fill out your name, phone number, email address, and answer a few questions about your current health, and then you can be seated inside. So those are some of the things that we're doing. But as we go out, my husband and I and some of our friends do still socialize and go out a little bit. And people are asking us for our name and our phone numbers when we go to dine in.
I love that.
So some of it's happening here in DC.
And some even, we were at a place recently that took our temperatures as well.
Oh yeah, they took our temperature last night, as a matter of fact.
I think that's wonderful. I hear Dr. Ford's point that some people may put in false information, and what do you do? But I think those kinds of apps and those attempts at getting that information are definitely to be praised, definitely laudable. What do you think about the utility of temperature checks, Dr. Ford?
So, it's like a medical exercise, I think, particularly because, what we all know is that the asymptomatic rate of transmission of this virus is beyond anything that we expected. So a temperature check in and of itself just means that you don't have a temperature. So far, we test, of course, our staff and all of our clients are tested every time they enter our building. And we have yet to find a febrile person, interestingly enough, yet we have quite a bit of COVID. So, it's just, it's helpful if it's positive, but have it negative or, not feverish does not necessarily mean that you're in the clear.
Right. I agree. So Sonya and Kamal, Northern Virginia. So for folks who are not in this area, Northern Virginia, Maryland, and DC, especially the suburbs of Maryland, the suburbs of Northern Virginia that surround DC, have been sort of moving together in terms of the phases that they're going through. But recently, Northern Virginia, I think this past weekend, broke away from that and decided they were going to do their own thing and move on to phase 3. Do you feel that do you feel disappointed that you're not in Northern Virginia, that you can move forward with everybody else?
No, we trust our mayor, Muriel Bowser. She's done a great job of guiding us, and seeing the other states, seeing Florida and South Carolina and California, these states with their issues. I mean, it really, I think that Washington is a very educated community, and we see that and say better safe than sorry. Let's take it slow. So we're in agreement with taking it slow and easy.
All right. And then in Atlanta, what kind of guidance is the health department giving to restaurants? And, is it as granular as helping them get protective equipment, or is it more just guidelines?
Primarily it's guidelines, because the state actually is the governing body. So we share whatever guidelines come through the state, but we have provided individual advice on sanitation, for example, and how to keep things clean. We have certainly been checking to make sure that masks are worn at least by staff. But and of course, to make sure that we're doing our regularly scheduled routine inspections, because when the governor put the shelter in place in effect initially, there were no restaurant inspections taking place as well. So we've kind of tried to catch up on that to make sure that just baseline, processes are being evaluated.
Wow, I think that's something to keep in mind. As you're making your decisions about eating out, keeping in mind that those things are backlogged.
Right.
In terms of regular health department checks, just because of everything going on. And I know we've talked just about the testing that you're doing in the community. How is that going?
So I'm proud to say that actually Dekalb is pretty extraordinary. The guidelines, actually, I just saw some today of what would be considered effective levels of testing are 1.5 per thousand citizens per day, which for Dekalb with 750,000 citizens would be, somewhere around 1,000, a little bit more than 1,000 a day. And we do about 2,000 tests every day. About a month ago, my goal for Dekalb was to do 10,000 tests per month. Based on some earlier guidance, and we're currently doing 10,000 to 12,000 tests per week, which is great. But the downside of that is when you test like that, you're going to see increasing positives, which means increasing contact tracing. And so that's when it gets sticky, because trying to get the manpower to trace that many people with some of the challenges I mentioned earlier is a beast. And so that's really where we're focusing a lot of our energy, is first of all making sure that people can get a test when they need a test, and the turnaround time, making sure that they can get their results in some time of reasonable time frame, and trying to explain to the public what our role is as public health, because I think they think that we do the tests, we run the labs. We don't. The tests go to a lab that is a commercial lab, and so we're waiting in queue with everyone else in the state for these results. And so I think that's a new frustration that's come up, is the timeline within which we get results, because of course that impacts contact tracing. If it takes you 5 days to get your results, well, you've probably infected a whole bunch of people in the meantime.
Right. And just having that clear guidance to people that even though you've gotten tested, you still have to self-quarantine until you get your result back, because you could still be out infecting people, as you just said. Absolutely. And I think along those lines, I mentioned that you are the incoming president for the NACCHO. Maybe you could tell us a little bit about what that is and what you're hearing from other county and health directors across the country in terms of challenges that they're facing.
So we affectionately call it NACCHO. And National Association of County and City Health Officials is a national organization of the 3,000 local public health departments in the United States. And so we are really the boots on the ground organization that advocates for public health issues. And, it's interesting because every February we have a visit to the Hill, the board, the leadership, to talk to legislators about different public health issues. And usually it's met kind of, it's Hill Week. So there's a lot of folks out there, you get maybe a few minutes. But this year, that's all everyone wanted to talk about was COVID. So, that was a good thing to have their ear like that. Nationwide, public health is struggling right now. We have had such turnover of leadership. I've never seen a medical situation that has become so political. We've seen a significant number of turnover of long-term leadership because of some philosophical beliefs about how this pandemic should be managed. And so this is a critical time for public health, and certainly not the time to be having a lot of turnover. So we're very concerned about that. And we're worried about burnout. We get a lot of heat. We get blamed for a lot of things that are out of our control. And even my own staff, I'm concerned about their fatigue. I mean, when you're tired, you make mistakes, and we can't afford to make mistakes right now.
Absolutely. And I hear some of those themes echoed with the medical profession, as you might know. I mean, medical people are tired and fatigued,
we're medical
and
people
angry. I mean, angry because of the politicization of this issue and people refusing to wear masks and Herman Cain tweeting from his hospital bed that, yes, you should go off to South Dakota and participate in the July 4th rally where you're going to be crammed in like sardines and not wear a mask. And you're in the hospital and the people caring for you are risking their lives. So yeah, a lot of medical professionals are angry and fatigued as well.
Excuse me, doctor.
Yeah, I was just going to ask if there are any questions.
Excuse me, doctor. Dr. Mel, you may have covered this in earlier shows. This comes from Angela Mays in Los Angeles. Dr. Mel, you may have covered this in earlier shows. Can we really feel safe with food prepared outside our homes? Does the virus live and transmit via food?
I have covered this, but I have the superstar Dr. Ford here, so I'm going to turf it to her.
So, the guidelines around restaurant inspections have not changed. And so your restaurant inspection is as thorough as your inspector is. And so that's certainly something I take pride in Dekalb County. We actually had a reputation at one point as the land of the U's because our inspectors were so strict. But that's a good feeling because you want a strict inspector. So it's an individual thing. I think we do a great job at it. The second half of your question was?
It was about whether COVID can be transmitted via food.
Thank you for asking that question. This is a viral infection like any other. Heat kills most things, and it's prepared if your food is prepared correctly. And first of all, the individuals preparing your food should be using the appropriate protective devices, including gloves, masks, shields, etc., so that you're at no more risk than you would be at any other time for contracting anything else from food. Our bigger issue with food historically has been, salmonella and things like that. And so we actually have not seen any direct infections coming from food. So that's one positive from all of this.
And I wanted to ask the Alis, do you get customers asking you that question?
No, I don't think we've had customers asking us that question, but, the masks, the gloves, following proper protocols. We feel comfortable and our customers feel comfortable.
Great. Next question.
Excuse me, doctor. We have a question coming from Lila Mays. This comes from Lila Mays. To the panelists, do you think temperature checks, masks, and etc. will be a part of our dining experience forever?
I'll take that one.
Please do.
I kind of do. I think it's going to be our habit for a lot of things, not just dining. I think, I've seen it in a lot of service industry settings. For example, I know nail salons, they catch you right at the door. Certainly massage places, some of the retail stores actually are doing temperature checks. So I think I hope it becomes habit. Not so much the temperature check, because as I said, that's just one weapon in the arsenal. But I love it when I see establishments pass out masks to patrons. I think that's a really important piece of this. That face covering is probably our best protection.
Absolutely. Any other questions? If not, I have one in the meantime. So both of you are in really, meaning the Alis and Dr. Ford, are in really high anxiety, high stress jobs. And so I want to ask each of you successively, I guess we can start with the Alis, what do you all do for self-care for you and your family to just kind of decompress from this whole thing?
Well, we have our kids home with us, and so they're from college, so that's nice. And the routine, you've really gotten down to a much simpler routine in life, right? There's nothing else to do, and so it's home and family, and you're cooking more, you're playing more games together, and you're doing these things which has brought families closer together. So I do see kind of a silver lining, in all of this, and that people have kind of taken time to say, there's no sports to watch, there's no functions to go to, you can't go hang out with the guys or the gals. And so people have kind of come back to the basics. And so that routine, in a way is comforting. You're in bed early and you're getting your rest. So
definitely eating well. I think that, because there's a lack of activity, when you're in the restaurant business, especially a restaurant that's open 7 days a week, and before COVID, literally open 20 hours plus a day on some days, being able to have a little bit of downtime. And so, we have about 13 team members who've come back, and it is allowing for us to have a day of downtime, not together, but separately. So I have a day, he'll have a day. And so that's helpful to just kind of be home and, kind of get your mind off of everything, because it is stressful when you're in that environment and people come in without masks and they lean on the counter and this is going to be the craziest thing, but there are actually people who will take their money, cash out, lick their fingers to peel off the money, which is the dirtiest,
Wow.
So,
Yeah.
You're dealing with a lot of interesting things sometimes. So,
Well, we've all seen those, and I am going to get to Dr. Ford with her self-care, but I just want to interject there that, we've all seen these videos of people in Costco coming in without their masks, sitting on the floor, refusing to leave. How are you all managing the public or customers who come in without a mask and insist on being in there without a mask? Do you have a protocol, or how do you manage that?
we don't get a lot that do that, but we do get some. And if they come in without a mask, our team is trained. We all ask, you're going to need to have a mask on. They either pull one out of their pocket or they'll go back to the car. Most people are compliant. Then you'll have people who have mental challenges, and they, on those rare occasions, will refuse. And we will talk to them 1 or 2 times, and then after that, we have to resort to other measures, as in asking law enforcement to assist us. But that has been very rare.
Yeah. And Dr. Ford, what do you do for self-care? Because I know you have multiple jobs and multiple hats and a family.
Yes. So working on that. Because we never sheltered in place. So I've been going to work every day throughout this pandemic. Happily, in May, I got to be relieved of my Fulton County responsibilities because they finally hired someone full time. So now I just am back to a single job, which is delightful. But I actually did something that was a personal thing. Dr. Clarke knows I'm a gym rat, and so to have the gyms closed was very traumatic for me. And once they opened, I still was not at all comfortable with returning, and so I invested in a Peloton so that I could keep my workouts private and clean, and it's been amazing because I was not aware of all the other apps, and this is not a commercial for Peloton, but one of the things that they have, the 2 things that I have used that I didn't think I would be using so often, is they have a meditation app and they have a yoga app. And so I have found myself at night definitely trying to use the meditation because I have to deprogram kind of at the end of the day. And so because my mind is constantly racing. And so that was kind of an extra added bonus in addition to the good cardio that offered to me. So it was definitely worth the investment. I also find that trying to thank God for Zoom calls, because Zoom has really allowed me to stay connected to family and friends that I otherwise wouldn't really get a chance to socialize. A, because of the pandemic, but B, just because I just work all the time. So between the Zoom and the Peloton, I've managed to maintain some level of sanity. And my son is here with me, which is the one less major thing to worry about, because he actually is a student in Florida. So I would have been a nervous wreck if he was not here.
Excuse me, doctor. We have a question. coming from Max Gregory Anderson in Atlanta. My daughter wants to go to an Airbnb birthday party with 10 friends. Later, go to an outdoor mall and go to a restaurant and eat outside. What is your suggestion?
Well, I'll be happy
Well-
to weigh in on that, and then Dr. Ford
do.
can also give her opinion. But as for the Airbnb birthday party, if that involves staying in the same house together, I don't think that that's a good idea, and I would deep six that. As far as eating outside at a restaurant, I think that would be fine with the proper social distancing protocols and mask wearing whenever appropriate. I think that would be fine, but I would find it hard to see how 10 people in an Airbnb who are there for the purpose of being close to each other and socializing would do so and be able to maintain the social distancing protocols at that age.
Yeah, I completely agree with that, unless they're family members, and in that case, they can just stay home and socialize. But you don't know how well sanitized the Airbnb was. So you don't know what you're sleeping on, or, what you're touching that may or may not be clean when you get there. And you don't know when the last person left. I mean, there's a lot to do with an Airbnb at this point. And in terms of restaurants, I always, I literally just had my first sit down meal in months yesterday, and it was with my son. And I'm always like, be ready to leave if this doesn't look right, because if I get there and I don't see the staff wearing masks, we're out of there. If they're not using paper disposable menus, if we're touching on the menus that everybody else is touching on, things like that, or if they don't have an adequate supply of hand sanitizer, things like that. So, there has to be flexibility. You can't just say, we're going to this outdoor place to eat, and because it's outdoor, that makes it okay. So, some sort of pre-planning about, we may need to have a couple of options just in case our first choice, it doesn't look like it's, adhering to what we think they should be adhering to.
I think those are all
doctor.
excellent. If I could just add one more thing, I think those are excellent points. And just to pick up on the Airbnb, I spoke with somebody the other day and mentioned just the air filters in the person's house that is in the Airbnb probably need to be changed in between guests as well. And we don't know that people are actually doing that also.
Right.
So,
Excuse me, doctor, we have a question coming from Bria Good. Question for both Dr. Ford and Mr. and Mrs. Ali. Are restaurant workers expected to change gloves after every meal served or prepared in order to prevent cross-contamination?
Yes. The easy answer is yes in our case.
In terms of gloves, that would be for the workers behind the counter. And yes, that would be an expectation. I will tell you, in Metro, I don't see wait staff consistently wearing gloves. In fact, rarely. I will see masks, but I don't always see gloves. And I don't believe that that's part of our executive order currently.
for the Alis, just to pick up on that, how did you do training for your staff, and over what period of time?
Well, we've had such a small staff that it's been pretty easy and consistent. And those who come back one at a time, we've just taken them aside and give them a little training. What else has been helpful is the supply of PPE supplies. Some of the government agencies and whatnot have offered PPE supplies. Signage partners, Gilbert Sign in our case has offered signage. The health department has been a good partner in coming by regularly and not being so much disciplinarian in terms of punishment, but in training and helping to identify. This is kind of a new situation for everybody. And so the constant reminders and help are beneficial. So, not just watching the social distancing inside your restaurant, but outside your restaurant when people are waiting for their meals and posting signage to that effect. So things like that. Good partnerships. I think that in general, people are very concerned. People are have educated themselves. I mean, there are a few outliers. I mean, there's certainly some of the younger people, if you wanted to generalize that, but people have done the right thing, I think, to a large extent. And now the question is, as my good friend and doctor always says, is don't let your guard down. Don't let your guard down. It's easy to have a drink and let your guard down. It's easy to see someone you're comfortable with and let your guard down. No, follow the protocols. If you wear the mask, wear the mask. Don't all of a sudden see your long lost friend and start shaking hands and hugging up. Give them the foot tap or the elbow tap and keep it moving. Follow the protocols. Exactly. Don't let your guard down, and that goes for us in business and setting these policies as well.
Yeah, absolutely. It looked like there was another question there.
It's a question from Alexis Proctor Kellum. Do the ventilation, air conditioning systems in restaurants have an impact in the spread of the virus?
So I'm going to ask Dr. Ford to answer that, and then I'm going to go to the Alis and see what they have been told from a public health perspective.
Well, the jury is still out on some of that, but anything that's ventilatory certainly can make things worse. And so we are trying to make sure that filtration systems are part of our assessment in terms of, like you said, air filters in restaurants. Good ventilation is spoken to. The executive order does not speak specifically to recommended types of ventilation, but does speak to open windows and things along that line.
Great. And then, Sonya and Kamal, have you received any guidance from the public health?
Yeah, we haven't heard anything. We haven't heard anything about the air conditioning systems or anything like that. I mean, I haven't heard anything specific about that. I mean, some systems take more fresh air in, and some systems circulate more. The air you have kind of depends on your system. But I'll tell you one thing. I say people don't like to be hot. And when you get people standing outside and you say, wait a minute, I waited 15 minutes for my large order, but I'm hot. They want to get that air conditioning. Okay. And we've heard that complaint on several occasions, and have tried to see about how we put the tents outside or accommodate that. Or you don't know if a person is outside who's ordered their food. You don't know if they've got a heart condition. You don't know if they're elderly. You know, there's certain things that you're trying to accommodate your guests, in a humane way, while dealing with the COVID as well. So. Right.
And I really admire you all's decision to defer on the indoor dining until you know all the factors that have to go into safe indoor dining. I think that's a really commendable business decision. I do know that there was one study, and I can't remember which country it was out of. It was out of an Asian country that talked about an outbreak in a restaurant that had to do with the ventilation system. And one table of people, one person was positive, and through contact tracing, they figured out that it was the ventilation system that carried it to the other tables. So yeah, I think, there's still some things that the jury is still out on. And, one thing I think is becoming my new mantra in this is, we don't know what we don't know. And that we can't rest our hats on anything because everything is evolving, and we're still all learning about this.
Excuse me, Doctor. We have a final question coming from Angelique Proctor. Her question is for Dr. Ford. How has the conflict concerning dealing with COVID-19 between the mayor of Atlanta and the governor of Georgia impacted your job and your advice?
Okay. So happily, I'm no longer in Fulton, so it is an indirect impact, but I will say that so the first mayor in Georgia to enact a mask regulation was in Savannah. We knew it was just a matter of time before Metro adopted something. And so I have had conversations with leadership in Dekalb, because having run both counties, I always feel like when it comes to Metro, there's power in unity. And so, I was trying to get a sense of what the true political will was around this, and, could we pull this off? But the problem in Dekalb specifically, and also Mayor Bottoms is the mayor of the city of Atlanta. Fulton County, where Atlanta lies, is not that's the whole county. And so that the city of Atlanta is one area, but right next door to that may be Sandy Springs or Buckhead. And so what is a Atlanta regulation may not be required in other areas. And so that's our struggle in DeKalb as well. As DeKalb County government could say, okay, we want a mask ordinance, but that is just for unincorporated DeKalb County. It doesn't speak to all of the municipalities, and different mayors have different sentiments about whether or not they are willing to enact it. And so what you would have is a lack of a contiguous geography that would have a mask. So you could literally be on one side of the street and have a mask requirement, and then cross the street and be in a jurisdiction that no longer requires. That's one issue. The bigger issue, though, and even with Atlanta's ordinance, is enforcement, because we don't want to have a situation where, God forbid, someone ends up losing their life because they refuse to wear a mask. Because tempers are flaring right now, and everybody's agitated for a number of different reasons. And I, for one, certainly don't want to see what should be a manageable situation escalate into something that turns horribly tragic. And so right now we are doing the strongly encourage discussion, and also making it available so that people can actually have masks, because it's one thing to say you must wear it, but for a while we had such a shortage of masks, it wasn't an option for people to get them. So we've had a number of different events where masks and hand sanitizer was distributed to DeKalb County residents through DeKalb County government. So it's not enough just to say you must if you don't provide them.
Thank you so much, Dr. Ford. That was a very comprehensive answer. And I want to thank both of you. Truly appreciate you all for being on. Thank you, Sonya and Kamal Ali, owners of Ben's Chili Bowl. Dr. Sandra Ford, good luck with your upcoming presidency of Nacho. Nacho, I'm sorry. Nacho. You know, it was a food episode. I'm sorry. Of Nacho. And I just want to wrap up by saying, with that last answer, I think it's so evident how, I talked about the coordinated response of DC, Maryland, and Virginia, and just how important that's been in this region. And, I can truly say with joy today that right before we came on the air, sometime this afternoon, the mayor announced that in DC, there have been 4 consecutive days without deaths in the District of Columbia. And they have, I think, done a great job in this region. But as you might have heard from Dr. Ford's answers, I think it's so incumbent to have a national response, because then it takes away the idiosyncrasies of one county versus another county. Even here in Northern Virginia, in the DMV, DC, Maryland, Virginia, Northern Virginia has gone ahead with phase 3 of reopening, and they're right next to DC, which is still in phase 2. And where there has to be some give and take, things like wearing masks, I think it would be wonderful if we had one policy that didn't vary and people didn't have to wonder, am I in a county where it's a mask ordinance or one that isn't? I think we've also heard too from the Alis all the different changes that they're going through and how thoughtful they've been in their business and their business decisions about making things safe for the public, and how it's important for high-risk individuals to still really be careful no matter what phase of reopening we're all in, and for all of us to be safe and practice the behaviors, the hand washing, the physical distancing, the mask wearing, the avoiding crowds. So I, again, really thank my guests this week. It's been a great episode. Thanks for your questions. And until next week at 9 o'clock when I see you, remember, please be well, be wise, and be health empowered.